This is no ordinary garden in the courtyard of an apartment block in Khulna, Bangladesh. On closer inspection, it's actually a constructed wetland to filter the effluent of an on-site wastewater treatment system. About 3,000 people live in crowded, run-down apartment buildings in this poor housing colony, which embodies the best and the worst of the sanitation situation in Bangladesh. The original septic tanks for the buildings, constructed in 1982, have long since broken down. In most cases, the pipes from the toilets have crumbled and fallen off the walls, leaving raw sewage to pour onto the ground. It has created a very serious health hazard for residents. There is one apartment building, however, which has been completely transformed by an on-site sewage treatment system. This is a pilot initiative of a local NGO, Nabolok, with funding from WaterAid Bangladesh. The NGO plans to construct low-cost wastewater treatment facilities for all 8 buildings in the colony. Bangladesh is on track to achieve the Millennium Development Goal for access to clean water and sanitation. In 2003, the government launched a successful campaign to achieve 100% sanitation coverage. Today, only 4 or 5% of the population still defecates in open places, compared to 42% when the campaign began. Despite this achievement, there remain many challenges to improving environmental sanitation in urban Bangladesh. Most people living in the capital Dhaka may use some kind of toilet, but about 30% are makeshift and unsanitary, especially in the 4,000 crowded slums which are home to an estimated 3.5 million people. Fecal waste is discharged into gutters clogged with garbage, exposing residents to the danger of waterborne diseases. Dhaka's largest slum is called Korail, covering 36 hectares in the city core with a population of 100,000 people. All the problems and miseries of slum life can be seen in Korail, but that is only part of the story. There is also a vibrant market and many small workshops which provide employment. NGO projects are visible everywhere, from daycare and healthcare to safe water and sanitation. An NGO known as DSK has been working in Korail since 2004. One of the biggest problems was lack of access to safe water. For years, community organizations pressured the water utility, Dhaka Wasa, to supply water to the slum. But Dhaka Wasa refused because residents are illegal squatters. Then finally, last year, a breakthrough. With financial support from the Asian Development Bank, Dhaka Wasa constructed a water pipeline into the slum to provide safe water for thousands of residents.
So now already we installed 456 water points in Korail slums. Our people are getting safe water, so they are happy. And also Dhaka Wasa are getting revenue.
আমরা আইডিয়া পাইয়া আমরা এই যে আগে ময়লার পানি খাইতাম আমগো রোগ বালাই হইতো অনেক ডায়রি হইতো কলেরা হইতো খাজলি পেঁচড়া হইতো জন্ডিস হইতো আমেশা হইতো আমাকে অনেক শিশুরা মারা যাইতো অনেক বয়স্ক লোক মারা যাইতো এগুলো এই সব রোগে তা আমরা এই যে ভালো নিরাপদ পানি খাইয়া আমাদের এই রোগ বালাই কমে গেছে আমাকে রোগ বালাই নাই শিশুরাও অনেক ভালো আছে অনেক রোগ থেকে আমরা মুক্তি পেয়েছি আর এই যে টয়লেট
The new water supply also made possible a big improvement in sanitation and hygiene. There are now 160 blocks of sanitary latrines with septic tanks. An underground drainage pipeline was also constructed to keep the main lanes dry. With more than 20 years' experience working in urban slums, DSK has refined a model of sustainable sanitation. Often sanitation projects fail after a few years due to poor management and maintenance. In this slum in Mirpur, a community of people with disabilities has maintained their specially designed latrines and bathrooms on their own since DSK pulled out in 2011. The key to sustainability is a strong community organization and ownership, and residents' willingness to pay for the water and sanitation services which make such a difference to slum life. Now NGOs are piloting larger-scale solutions to improve environmental sanitation in poor communities. This DSK on-site sewage system is treating wastewater from 252 household toilets in Mirpur Bauniabad slum. Serving a neighborhood of more than 1,000 people, the project covered the capital cost of construction of the sewage system. Operation and maintenance is looked after by the beneficiaries.
এই জন্য আমাদেরকে মানে ডিএসকে আগে ট্রেনিং করানো হয়েছে যে কীভাবে আমরা রক্ষণাবেক্ষণ করবো এবং কতদিন পর পর পরিষ্কার করতে পারি। হ্যাঁ, এই জন্য আমাদের ট্রেনিং করা হয়েছে এবং আমাদের যে মানে আমাদের সঞ্চয়টা যে ব্যাংকে জমা আছে তার থেকে আমরা এটা মানে রক্ষণাবেক্ষণ করতেছি।
Sludge management is another big sanitation challenge and public health issue. The government has started to address this problem in the recent Secondary Towns Water and Sanitation Project. The project is supported by ADB and implemented by local government bodies. A pilot initiative in 10 towns includes sludge removal equipment and services and construction of a sealed drying bed for the safe disposal of sludge.
When the septic tanks are full, the people are throwing or dumping this sludge to here and there, just polluting the environment, creating nuisance to the people. But in this project, we have constructed a sludge removal location, a specific place for dumping. My feeling is that this wastewater management is very important and the time has come to give good importance and concentration on this issue.